While COVID testing sites like these are seeing less traffic these days, it's not because COVID has disappeared, but there are less people testing. With home test kits, many people are using their own diagnostics to treat their individual health and risk reduction.
As the case counts go up, and especially given that we can't measure the accurate number of cases and transmission in the community, we do expect to see our hospitalization rate continue to go up. We're seeing that on the East Coast. We're seeing that in Utah.
While the original coronavirus has created some herd immunity, there are still several variants mixed into the equation.
So we know immunity fades with time, and these viruses are more resistant. So if you were infected in December, that's 6 months ago. So with a different virus and 6 months having passed, your protection was pretty good in March, but it's not so good anymore.
As schools are letting out for the summer, questions arise on what will happen to the variants of the virus next.
And there was a little bit of a change in symptoms as we moved from the older strains like Alpha and Delta to Omicron. We saw more upper respiratory symptoms, more sore throat. In children, we saw more croup and bronchiolitis and a little bit less pneumonia. We don't really have enough experience yet with these subvariants, the BA.2, BA.2.12.1.
And the more touches with the virus you've had, and especially the more safe touches through vaccination you've had, the more robust the immunity is against these new variants that continue to emerge.
While herd immunity is one way to make the virus less severe, these doctors say it's not going to provide complete protection.
One of the most important parts of our strategy to live with COVID as it ebbs and flows is one of personalized or individualized risk reduction. Individualized risk or personalizing your risk reduction means doing things to prevent getting COVID, to prevent getting severe COVID, and making changes if necessary in your behaviors to prevent passing it on to those with whom you associate who might be vulnerable.
While doctors are seeing more mild cases with those who have immunity, hospitals are still experiencing a major staff shortage due to people calling out for COVID. And while only 4 deaths were reported in Utah in the last week of May, there were still 118 hospitalizations with 18 in the ICU. Those most at risk are over the age of 50 with underlying health problems and a compromised immune system.
As we're focusing less on people ending up on ventilators and dying in large numbers, we have to really think about this big burden of children and adults who are really having their lives changed for months on end, and figure out, how to prevent it and how to treat it.
While less testing for COVID continues, less people may tend to stay home when they are sick. So testing of wastewater has been another way to find out what a community has been dealing with.
The amount of virus in the wastewater, basically, that is showing up in people's excretions is going up. That it correlates very well with the amount of disease in the community going up in the next couple of days to weeks.
I think right now we're expecting to continue to see cases rise through mid-June at least. And then we're really going to have to reevaluate and see what other variants are on the horizon.
Just like the virus, strategies and protocols change, but prevention should always be top of mind.
That's the reality of the phase we're going into. You need to think things through in terms of how it affects you, your family, and the people around you.
Melissa Anderson, Community Education News.